Now we have a 10-month-old with fever of 101, decreased PO, and has these lesions found on the bottom of her feet, hands, buttocks, and she has mouth lesions as well. This is a multi-select. When can this child return to daycare? Choose two. If you picked when afebrile, off antipyretics, and when lesions in the mouth are gone and skin lesions and have dried up, you are correct. This is hand-foot-mouth disease caused by enterovirus infection, particularly Coxsackie virus A16. Multi-select again. Select a possible trigger or triggers for this rash. Right? If you said all four, you are correct. This is erythema multiforme with multiple possible etiologies. It's a hypersensitivity reaction, usually triggered by infections in about 90% of cases, with the most common being HSV, then mycoplasma, then other viral triggers, and even viral vaccines. And tinea has been reported as well. The remaining 10% are due to drugs. In the typical course, a few to hundreds of skin lesions pop up within a 24-hour period and are first seen on the back of the hands and or tops of the feet, then spread down to the limbs towards the trunk. Most cases involve the upper limbs more than the lower limbs, with clustering of lesions on flexor surfaces. And remember, there can be typical and atypical target lesions. Another multi-select here. Select the most likely pathogens. So this is Impetigo, with group A strep and Staph aureus as our most likely culprits. Classic honey-crusted lesions typically found on the nose and face, but you can also see it on the hands, trunk, perineum as well. Treatment is wound care, topical antibiotics, severe cases, oral antibiotics. Also, telling parents covering lesions to prevent spread is really important. Multi-select. Select your next best step or steps. This is a scary one, and all the answers are correct. This is eczema herpeticum due to HSV and bacterial superinfection. All right, we have a fun one. This is a happy baby who comes to see you for a rash on the cheeks. He's been well, but fussy at times due to teething. Double points. What's the most likely cause of this rash? A lot of answers there. So this is an example of cold panniculitis. As you found out, mom gave him a popsicle to gnaw on for teething pain 2 days ago. And cold panniculitis in these cases is caused by either exposure to cold, popsicles, or ice packs, and mainly occurs in infants. It affects the cheeks and chin, with skin findings showing up 1 to 2 days after contact or exposure to cold. And the reason this only happens in neonates and infants is that they have increased saturated fat in their subcutaneous fat, as opposed to children and adults who have more unsaturated fat. Okay, we have a 2-year-old who presents with fever, fatigue, rash, and swelling of bilateral hands. They were diagnosed with otitis media 2 weeks ago and finished a course of amoxicillin about a week ago. What's the most likely cause of this patient's rash? So serum sickness-like reaction is the correct answer, and it follows the use of medications, traditionally cefaclor, which we really don't use anymore, but it can also be seen with penicillins and other antibiotics, NSAIDs, antiepileptics, antihypertensives, and more. It's usually seen in kids 6 years of age and under, and after a second or repeated course of antibiotic rather than the first, and shows up between 1 to 2 days to 1 to 3 weeks after a med exposure. The rash is urticarial, pruritic, lasts minutes to hours, switches locations, and can be followed by an ecchymotic appearance. Kids may also have fever, fatigue, facial swelling, joint pain, and possibly swelling in the joints that is symmetrical. Treatment includes stopping the med trigger, considering oral antihistamines and steroids, and advising parents to avoid the medication or class of medication in the future. So this next 9-month-old presents for the following rash: persistent crying and diarrhea. She recently transitioned from breast milk to formula. Double points. What treatment is required? So here we have Acrodermatitis enteropathica, I probably butchered that, caused by zinc deficiency due to an inherited zinc transporter defect disorder, which presents with a classic triad of periacral, periorificial dermatitis, diarrhea, and alopecia, and can be fatal. Primary cases show up in formula-fed babies shortly after birth and in those breastfed after they are weaned. 8-year-old presents with fever, sore throat, vomiting, and the following abnormalities seen on exam. He had a blister on his chest first that is scabbed over. What's the most likely cause? Yes, this is cat scratch disease caused by the bacteria Bartonella henselae, which we all know is a bacterial infection that causes a subacute regional lymphadenitis after a patient has been scratched or bit by an infected cat or kitten, usually about 1 to 8 weeks prior. The nearest lymph gland to the site of trauma right here becomes swollen and tender. Half of patients may also have fever, fatigue, headache, nausea, vomiting, sore throat, rash, even abdominal pain or conjunctivitis, and up to 14% have complications due to dissemination. Treat with azithromycin and refer to ENT for biopsy and excision. True or false? Prescribe topical antifungal. False. Topical antifungals will not penetrate the root of the hair follicle in tinea capitis. You need an oral antifungal like griseofulvin for at least a month, and you don't need to check LFTs when using it for that time frame. Now we have a full-term, 2-week-old, born via vaginal delivery who presents for the following rash without other complaints. What's the next best step? Yes, so the most appropriate step would be reassure and discharge home for this case of Erythema toxicum, which is a common and benign condition seen in newborns without a clear-cut etiology. What you see is a combination of erythematous macules, papules, and pustules, which flare and recede over several days, often starts out on the face, then spread to the trunk and limbs, sparing palms and soles. An individual lesion usually doesn't last for more than a day. It goes away in a few days. Some cases can last for up to 2 weeks. These babies are well, as opposed to those with more sinister rashes like HSV, varicella, or CMV. All right, we have a 5-year-old who presents for evaluation of an itchy bottom. FYI, this was the best picture I could find of this perianal rash. I didn't want to search too much for this for obvious reasons. What's the best treatment for this condition? Okay, if you picked amoxicillin for perianal streptococcal dermatitis, you are correct. These cases are frequently misdiagnosed as pinworms or candidiasis. Rapid strep and throat culture can be used to diagnose, but make sure your institution will allow rapid strep testing from a non-pharyngeal source. Treat with oral penicillin or amox and topical mupirocin. Now we have an ill-appearing child presenting with fever, nausea, vomiting, diarrhea, abdominal pain, who was febrile, tachycardic with borderline blood pressure. Her parents had cold symptoms 3 weeks ago. No travel, and the only medication is acetaminophen. What's the most likely cause of this rash? Yes, this rash is in a patient with MIS-C, multisystem inflammatory syndrome in children, that's been associated with COVID-19. Stats really range on this new entity, but between 50 to 80% of patients with MIS-C will have a rash that appears within a broad range of characteristics. We're all familiar with the similar symptoms to Kawasaki's, but just to quickly review the CDC criteria for MIS-C, we're talking about patients under 21 years of age with fever 38 or higher for 24 hours or more, or a report of subjective fever lasting 24 hours or more, who have lab evidence of inflammation and evidence of clinically severe illness requiring hospitalization with multi-system organ involvement and no alternative diagnosis, and positive for either current or recent COVID or exposure to suspected or confirmed COVID case within 4 weeks prior. What really worries us about these patients is they may develop myocarditis, cardiac dysfunction, and or AKI. All right, we have a 7-year-old local kid, well appearing, who presents with this non-pruritic, non-painful rash behind his knee that's enlarged over the past 3 days. No other complaints, no travel, camping, hiking, and no history of tick bites, and no drug allergies. Multi-select. What would be the best antibiotic choices for this rash? If you picked amoxicillin and doxycycline for erythema migrans in this 7-year-old, you are correct. You all know a ton about Lyme disease, but what you may not know is that the AAP has now okayed doxycycline as the treatment of choice for all ages and not just for those above age 8 years. This might be a tough sell to many though, including myself, since if amoxicillin is still okay, why would one take the chance on teeth staining, nausea, vomiting, and sun sensitivity? Next up is a 3-year-old who presents with the following rash after a week of fever, fatigue, mild URI symptoms, which have all resolved, and a positive monospot at their PCP. Double points. What's this condition? Yeah, so this is papular acrodermatitis of childhood, also known as Giannotti-Crosti or papulovesicular acrodermatitis of childhood. It's a papular, usually pruritic rash that occurs in response to a viral infection like hepatitis B, EBV, CMV, the enteroviruses, echoviruses, and RSV, and occasionally to vaccines as well. Most kids look and feel well. Some may have a low-grade fever, no specific treatment. If they're itchy, you can recommend a low-potency topical steroid, emollients, and antihistamines. This 17-year-old recently returned from a trip to visit family in India who has had 2 days of fever, malaise, and loss of appetite. He has Crohn's and is on chronic steroids. What is the best lab to order at this point? So these are Koplik spots seen in measles, and the best test is PCR. by a throat or nasopharyngeal swab for symptoms less than 3 days. IgM usually does not turn positive till after 3 days of symptoms. Here we have an X-ray for a 9-year-old that fell while climbing a tree. Name this fracture. So, Monteggia fracture is a fracture of the proximal third of the ulnar and associated with radial head dislocation and instability, most common in kids ages 4 to 10 and rarely seen in adults. Also, make sure not to miss associated radial head, coronoid, and olecranon fracture dislocations with this fracture. And FYI, if you picked Cacio Cacavelli or Bocciocino, those are both Italian cheeses, so sorry about that. I just had to take advantage of that. 8-year-old presents with fever, nausea, vomiting, abdominal pain, sore throat, and rash. Pick the best treatment for this condition. Moxicillin is correct for group A strep, scarlet fever with the classic sandpaper-like rash on erythematous skin with red streaks or pustules, not seen here, from ruptured capillaries in the axilla and elbow. By day 6, the rash starts fading and peeling. Otherwise, well-appearing 14-year-old presents with this rash. Name it. Lots of responses on that one. Okay. So Pityriasis rosea associated with reactivation of herpes viruses 6 and 7. Key points identifying the herald patch and scaly type rash. Kind of blur your eyes, it's in a Christmas tree distribution. You're evaluating the next patient for fever and cough and note these abnormalities on the teen's back. True or false? Report this case to CPS. All right, this is actually consistent with cupping and is a form of alternative medicine practiced for thousands of years in China. My residency was in the middle of Boston's Chinatown, so I really saw this frequently, but I remember really being worried the first time I saw it. And since we're nearing lunchtime, this next formula-fed 11-month-old presents after parents opened their diaper and saw this. Earlier in the week, the infant was diagnosed with otitis media. Double points. What's your next best step? So this is actually a benign side effect of the antibiotic Cefdinir that may cause red, rust-colored stools, which are guaiac negative in patients on iron or taking products that have iron in them, like infant formula. Cefdinir, its metabolites, combine with iron and form a precipitate that discolors stool. No known adverse effects of this. Once the Cefdinir stops, it stops. 13-year-old presents for a week of fatigue and the following rash. You also note some papules over her elbows. Double points. What does this cutaneous finding suggest? Okay, so this is the heliotrope rash of juvenile dermatomyositis, which is the most common form of idiopathic inflammatory myopathy affecting children and adolescents. The skin changes precede the muscle weakness or myositis, so recognizing this to get the patient hooked up with rheumatology is super important. 2 more to go. 4-year-old presents for abdominal pain, decreased urination, joint pain, and you note this rash on exam. What would be the next best step? So Henoch-Schonlein purpura is a form of small vessel vasculitis with kidney involvement in up to 50% of cases. So checking a BMP and UA is important. Classic presentation of HSP is rash, arthritis, abdominal pain, and kidney impairment. Almost all cases have a rash that starts out like hives and then rapidly changes to palpable purpura. For most cases, no specific treatment is needed and the rash fades over a week. The key is discussing with peds nephrology to determine the treatment and follow-up plan. And now we'll end with a fun one. Double points. Which plant is to blame for this rash? Okay, so this is a phototoxic reaction to limes called phytophotodermatitis. You may have heard of this with bartenders in tropical places, and I actually had this as a child down in South Florida where I grew up after a Lyme spa day in the pool with a friend, which I finally confessed to my mother about just a few years ago. Basically, it's caused by light reacting with a chemical in certain plants like limes and lemons and even carrots, causing a contact dermatitis and pigmentation. By the time the pigmentation has occurred, the inflammatory phase is over, and that means topical steroids won't help anymore. It will just gradually fade over weeks or months on its own. So let us see our podium. Great job, everyone. Thank you.